Hello, everyone, and thank you for joining our webinar today. Today, we'll be covering Beyond the Basics, a webinar on elevating dental patient experiences from crawl to run. Today, we have Raquel joining us, so I will pass it along to Raquel.
Thanks, Megan. So welcome, everyone. We're really excited to talk to you today. We'll be touching on the emotional and logistical sides of crawl, walk, and run levels of patient experience. So the purpose of today is really to dive into each side of each level and help you gain insights into understanding where your practice is at. And we'll also talk a bit about what you can do to get to the next level and improve your patient's experience. Before we get started, I'd love to just introduce myself. So a little bit about me. So my name's Raquel. I'm the Senior Manager of Customer Experience here at Intiveo. I've been at Intiveo for about 5 years and in CX for almost a decade. So me and my teams, we work with dental offices, dental service organizations, and academic dental institutions just to ensure that they're successful with the Intiveo platform. We make sure to understand their businesses, their pains, challenges, and how we can help solve them. So let's dive in. So we're going to start at the crawl level naturally. So just an overview. When we look at the crawl level, we're talking about a lot of manual tasks. So very task heavy days for staff. And the tools available for staff are pretty minimal and traditional. And what I mean by that is phone communication is primarily the only way of communication. So let's get into the logistical side of the crawl level. So like I mentioned, phone communication is heavily used here. So any appointment related tasks, anything like reminders, confirmations, recall bookings, communicating with patients about pre or post surgical appointments. It's all happening over the phone. So this poses a number of challenges, where calls or voicemails might be overlooked. Patients are on hold for long periods of time or waiting in the office to get the attention of the staff. Or, patients might actually not be reached. So they might be missing appointments, leading to high no-show rates. And another part of the logistical part of the crawl level is manual work for the patient and staff. So what that means is filling out forms by hand. So patients either have to come in early, and that's if you can reach them by phone to remind them to fill out their forms. If they don't come early, if they come on time or even late, that might delay the schedule and delay the day. Even if you are able to maybe even send it via PDF through email, they probably have to print it and fill it out. And I would assume most don't have a printer at home. And then on the staff side is they have to decipher the handwriting and update the PMS. And then so patient has to remember their insurance for direct billing, or if direct billing is not available, they'd have to do it manually themselves, which can be really frustrating. And then the feedback loop is hard to manage. So staff members are having to ask for feedback directly, like in the office, if they get a chance between phone calls. So it's not the most comfortable conversation, especially if things didn't go as well as hoped. And there's no trackable way to actually follow up on the feedback. So, if the thing is, patients might feel too much pressure or might feel quite uncomfortable to talk about their experience and just say it's great, even if it wasn't. And then it's hard to manage with the rest of the team. So if the staff does get negative feedback, making sure that they follow up on it with the rest of the team to ensure that they improve next time. So what this results in is, patients may not feel heard or might be hard to establish a sense of trust with the practice, and that could ultimately result in either poor reviews. They might, jump on to Google and write a review instead, or even lose patients. Let's dive into the emotional side. So, because everything is so task heavy, like a lot of things to do, constantly on the phone, everything's very manual. That means there's very little time to connect with patients. Staff are so busy that they're just trying to get through the day. And so they don't get that time to build relationships with patients, check in with patients when they come in, especially if they're feeling anxious about their appointment. Um, as everyone's probably very familiar, sometimes that having, going to the dentist is a little bit anxiety driven. So it definitely happens for me, and it really helps when I'm able to kind of have a positive interaction with someone at the office before I get into my appointment. And then another part of the emotional crawl side is practice doesn't have any core values or expectations set. So usually having core values or expectations just helps as a guiding light for the staff. Some examples might be consistency, kindness, efficiency, things like that. Things that would direct staff to, on how they should treat patients as well as each other. So if this hasn't been defined or discussed by the team, um, the practice is going to lack some clarity and sort of purposefulness, and doesn't allow or it doesn't allow the staff to really know what's the first priority. So that's the crawl side. Now we get to walking. Um, so when we get to the walk level, what this means is the practice has identified that some things need to change. So identifying the change, and that at least some sort of patient experience software has been chosen to help start creating those efficiencies and improving the patient experience. So let's walk through the logistical here. So staff is on the right track, recognizing the change, having at least maybe even installing the software, but might not be taking advantage of all the features. So there might be lots to offer through the software, but the practice hasn't implemented all of those things to really benefit from sort of all the automations and efficiencies that can come out of it. So lots of work to do still. So some things might be automated, like reminders or confirmations, and that might mean confirmation has improved. Maybe the no-show rate has decreased. It's because the system is able to reach way more patients than the staff might have been able to. Um, but there's still some manual tasks. So like we said, not taking advantage of all the features, maybe recalls aren't automated yet, forms aren't digital yet, they're still paper or PDF, and still not able to bill insurance directly. Now getting into the emotional side. So kind of touched on this earlier is the, recognizing the need for change and acknowledge that there needs to be adjustments. So it's the beginning of the alignment with staff to improve the emotional side of the patient experience. And the practice is also working on identifying what the core values are, what those expectations are for the practice so that staff knows what's expected of them and what they need to do to improve the patient experience. The thing is, on the patient side, not much has probably changed. Yes, there's automated reminders, which definitely helps, but there isn't, because there hasn't been enough time yet to implement all the changes quite yet. They might still be filling forms out by hand, or like we mentioned earlier, um, not able to directly bill their insurance. So still quite manual. So patients aren't feeling all the changes quite yet. Now we're running. So getting to the run level. So overall, means the practice is taking full advantage of all the features of their patient engagement software, and they're seeing the better efficiencies within the practice and accessibility for patients. So let's look at the logistical side. So that means we've talked about this before with similar to the walk level, appointment reminders and confirmations are automated, and that means patients are receiving reminders in the channel that best suits their preferences. So whether that's email or SMS. And what it also means is the staff is probably spending 1 to 2 hours less on manual phone confirmation. In addition to that, recall reminders are probably automated, so staff spending less time getting through long recall patient lists, and just focusing those who are overdue and ignoring all the reminders, which tends to be a much smaller list. And then there's digital forms, so patients are able to fill out their forms ahead of the appointment. So, at a time that's probably way more convenient for them as well as the practice. And so what this means, the schedule is less impacted. There's better completion rate on the forms. Staff are spending less time on entering information because it integrates with the PMS. And bonus is if the software allows them to remind patients of incomplete forms before their appointment, to kind of send, so that staff are spending less time on the phone reminding patients to fill it out. Additionally, there's probably customized appointment reminders, so patients are receiving important information prior to their procedure, especially helpful for surgical appointments. So that means patients are showing up prepared for their appointments, might mean fasting or things like that. And that means less opportunity for gaps in the schedule. If a patient does show up unprepared, you might have to reschedule the appointment because they didn't fast. And lastly is the automated feedback allowed for private feedback. So patients are able to provide feedback after their appointment privately without having to talk to staff in the office and feeling uncomfortable if it's not the most positive conversation. So, staff can follow up directly and have a private conversation and see how things are going. And then, being able to track that and align with the team on what improvements need to be made. So overall, more efficiencies and convenience for the practice and its patients. So yeah, emotionally for running, I'm a little out of breath there from all the running. Emotionally, the practice has a set of defined values that are understood by the entire staff, which is fostering, a sense of unity as well as consistency within the practice. So what that means is, staff have defined expectations. They have more time to connect with patients. Patients are feeling heard and their experience is a lot smoother. And yeah, just overall a much smoother, more efficient experience for everybody. So those are all the levels. Just to quickly summarize what we've just gone through. So we have crawl, walk, run. So at the crawl level, we're talking about really task heavy manual work happening within the practice, and a lack of connection with patients because staff are just so busy, they just don't have time or they don't have alignment within the practice. At the walk level, there's the beginnings of implementing some sort of patient engagement software, and there's an acknowledgement for change. And then at the run level, there is software installed and it's being utilized to its full potential. So, and the practice is getting a lot of value out of that. And so seeing a lot of efficiencies within it. There's clear expectations with the practice, clear, some core values to provide that unity and alignment. And so the practice is staff is actually able to have more bandwidth to empathize with patients, connect with them further, and give them a little bit more attention so that there's a real sense of trust within the practice. So how does this information help you? So what we want this information to do is help you evaluate where your practice is at and help you plan for the future. One thing I want to note is, with these levels, you could be at a crawl logistical, meaning very task heavy work, but you acknowledge the need for change. So you're at the walk emotional. So don't feel like you have to bucket yourself just within the crawl, walk, run levels. You can dig into the emotional or logistical. But some questions to consider to help you identify where your practice is at is, what does the team at my practice value? And what do my patients value? And, what are the inefficiencies that we have to address that could give our patients a better experience? If you want to learn more, we do actually have a more in-depth guide on this information, so you can dive deeper into these levels. You can access this guide on our website now.
Okay, thank you so much, Raquel. That was great. I just wanted to open up the floor to for a few questions. It looks like we did have a few questions pop in during the presentation. So if anyone has any other questions, feel free to put them in the Q&A box below. But our first question is, I work at a practice with mostly older patients. What are some ways to prepare them for a transition like this?
Yeah, this is a great question. So one thing I'll note is I've we've found that older patients are more in tune with technology than you think, especially if that's how they're communicating with their family and on a regular basis. So, my biggest tip is to, let them know, like take the time to reach out and let them know we have these changes. And when they're in the office, if you want to dedicate some time to show them what things are going to be looking like in the future, just to, sort of ease those changes for them.
Great. Okay, question number two is, do the logistical and emotional sides have to go together, or could someone be at a crawl level for the emotional side and the walk level for the logistical side?
100%. You could be a mix of 2. Yeah, don't feel like you have to box yourself into just the levels alone. You could totally be at the crawl side in terms of logistical, like you're very task-heavy practice, very manual, but you recognize the need for change and you've started to align your values and expectations, and just haven't taken that extra step to look at software that could help you drive more efficiencies.
Okay, and our final question is, what is the average amount of time that the process of going from crawl to walk to run can take?
We're talking if we go from crawl to run, it could take as little as 6 months. Um, if you're just starting to look at patient engagement software, I mean, you could be looking at 3 to 4 months to go from crawl to walk. If you've already decided and moved forward on, setting up some software, you could be up and running in like about 2 months. And I'm talking primarily about logistical sides. You could move as quickly as you want on these things. Usually it's quite easy to set a lot of these things up. So what might affect your timeline is how your staff and patients handle the change. So I would strongly suggest, establishing expectations when you start to embark on this journey. So, everyone's aligned and how the process is going to move forward. That will really ease um, things and hopefully improve your timeline, depending on how fast you want to go.
Great. Okay, so that is it for our questions. Thank you, everyone, for joining us today. And thank you, Raquel. That was so helpful. You can find this webinar recorded on our website. If you have any more questions, we would be happy to answer them. So thank you, Raquel.
Thank you.